All right, Bob. So first of all, thank you for taking the time to do this and being willing to be on screen and also give us the permission to actually share this on social media. We'll do it with respect. The key is to create awareness so that patients, doctors know that it is time to stop pulling teeth and sacrificing them. But there's also the story I want you to tell of how you felt like no one was really able to believe that these teeth were worth saving. But then there's also the story today, which is about 24 hours later, and you have so little pain and you took so little pain medication. So lots to tell. All yours. No stress though. No pressure.
So I think my story starts probably about 4 years ago when my doctor at the time, or the dentist at the time in Woodburn, I went to them because of so much pain in my upper mouth, and it was just kind of, at that point, just felt like it was moving around um, in the upper teeth, and he couldn't find anything. He thought maybe there was a crown that had a problem, but that crown was pretty new, and so the only thing I could do to fix it is I had some leftover amoxicillin, and I
Ah.
took that, and it kind of made me feel better for a while. But anyway, I found out about laser when I had an emergency episode where I broke a tooth when I was traveling in California, about in the Mount Shasta area. And the wonderful dentist down there who did my emergency help and gave me a new crown for that tooth. I was talking to him about my root canal problems, and he said for molars, there's no way he would even touch one, but he did other teeth for sometimes. But he said he always recommended to use the laser because it cleaned out all the nooks and crannies. And it was so much better because you just couldn't do that through the microscope. And so when I came back from that vacation, I started looking into it and found, after a lot of search, that the only one in this area was Dr. Wynn, and I'm so grateful to have found him. But anyway, now today, it's one day after the procedure on this tooth, the microsurgery. Unfortunately, we also had to do the endodontic treatment first, so we treated this tooth twice. But anyway, its pain is almost gone now. I mean, it's like a 2 or a 3 at the most, and it's been 24 hours since the procedure's been finished, and all I had to take was 3 ibuprofen tabs to start with right immediately after procedure, and I didn't take anything else after that. And of course, we can give it credit to Dr. Wynn and to the healing laser he used, and the wonderful job he did on this procedure.
It's actually a team effort, right? I mean, the procedure went fast, which plays a role in the pain level, right? The faster it is, and we spent about an hour. You and I were kidding yesterday. You were watching your clock, and I was watching mine, and it was an hour and 3 minutes. So that plays a role, and that definitely is credit to you and to me and to Lin Feng, because the faster or the better we work as a team, the faster it gets. And you laid in the right position, you were still, so that's one thing. But you're right, it's it's the skills of the surgeon, but it's also the equipment, and the 2 lasers kind of work hand in hand and work with me. Now, so you took, just to make sure people who are listening realize this, you took 3 times 200 milligrams of ibuprofen, right?
Right, yeah, just a standard off-the-shelf pill, yeah.
That's right. Okay. And then that's pretty much the only thing you took since yesterday,
Yeah,
right?
that's the only pain med I had. Yeah.
That's right. Beautiful. This is, again, people don't realize this. They think it's a horrible procedure. And we just looked at the photos, and the gums look great. So I think we are on the right track there. Now, let's rewind a little bit. You were sharing your story with me about how this tooth was sentenced to death, right? And it was supposed to be extracted, and they only gave you 2 options, correct?
Right. The same doctor that I had gone to with all the pain, the same dentist, In a later visit, he found that there was a problem with that tooth, but he didn't tell me what it was. He didn't say anything about that it was, bone infection or anything. He just says that we have to get that tooth. That tooth is not going to last. And he says, so there's two options. He says you can do a bridge. We're going to have to replace a crown on the one side and add a new crown on the other side and create a bridge across there, or get a implant. And the implant was the more expensive of the two options.
Mm-hmm.
And, I wasn't really happy with any of them at that time, and I just felt like I needed to find something else. And so I was kind of at the point I said, well, okay, when it starts hurting, I'll make the decision then at that time. And so that was kind of where I left it. He also sentenced another tooth I had to be extracted, but I ended up having to have that one extracted and have an implant on that one. But I think it looks very good now that we've saved this tooth.
Oh, absolutely.
Had been sentenced to be death.
and
extraction.
And it is death for the tooth.
Yeah.
Once it's gone, it's gone.
Yeah.
We should know in a month or two, like I discussed with you. We should see bone healing really fast, and we can celebrate that time. But I've done this long enough to know that we've cleaned the inside. And then we went to the outside as it became necessary. We went to the outside and removed the root tip. Yeah. And the success rate is virtually 100%. It's never 100% as is, but it's virtually 100%, meaning right underneath, So, I can't wait until a month or two from now, and we'll celebrate together. Okay. Maybe last words, Bob, from a patient who's gone through the procedure, and you've gone through actually a root canal, right? That was before me, and we redid it.
Yeah.
And then we did the aqueous surgery here, the microsurgery. Yeah. So maybe last words from a veteran?
It's not as bad as you might think it might be, and it gets over with quick. I just wanted final words about this team here. These guys are the best, really. The attitude and the feeling here is just amazing. And so I want to thank you for that. Just a loving, caring feeling. So thank you for that.
Oh, you're very welcome. And if we take care of the person and not the tooth, right, Bob?
Yeah.
Then the feeling is that way. Yeah. But if we only see the tooth sitting in the chair, then that's when things really... And clearly we see you as a person. So thank you for doing this again. I appreciate it, and many people will benefit from this, Bob. Thank you. Yes.